Information is power, but only if you use it. That's what campaigns such as Wear Plaid for Dad and Movember are all about, empowering men to be proactive about their health by raising awareness about what might ail them. Are such campaigns working? And is there more to be done to get fellows taking better care of themselves? Let's find out from Dr. Dean Elterman. He is a staff urologist at the Toronto Western Hospital and University Health Network. Dion Duncan, Vice President of Development for Rosa Centre, a nonprofit care facility in Halton Region. And Andrew Simon, Chief Creative Officer, Edelman Canada, the National Public Relations Agency. And it's good to have you three around our table here tonight to talk about a very timely subject. And as odd as this may be, to talk about men's health, I'm going to start with the woman amongst us.
Thank you very much.
Here we go. Let's lay the groundwork for understanding men's health. As a general statement, whose health is worse, men's or women's?
An interesting question, and I'm going to answer it directly. In fact, both of them are almost equal. We're seeing an increase in the rise for prostate diagnosis, as well as breast cancer. But what we're also seeing is an increase in the age demographic. So both men and women are facing the same, either A, mortality rates, or B, facing the same diagnosis. That
goes against the conventional wisdom, I think, which is that men's health is generally way worse than women's. Not the case anymore?
Well, I think we've made some good strides in terms of bringing the focus onto men's health. But generally speaking, men are going to die earlier. They're going to live more years in poorer health. And they're more likely to have advanced diagnoses of such diseases as heart disease, having heart attacks, strokes, etc. So again, I do think it speaks to the fact that perhaps men aren't necessarily addressing their health concerns at a proactive early stage.
Would you grant that?
I absolutely would agree with that. Yeah. In fact, we're seeing less of a focus on youth, on adolescents, and on men between the ages of 21 and 51. They're not going to the doctor unless something really hurts or unless there's a really big rash, when women are actually driven to the doctor for different reasons, such as they're in the birthing years or they're premenstrual. Men are waiting, and the late diagnosis is what we're really seeing an increase in our particular industries.
So men are just not proactive. That's part of it.
Just not proactive.
Okay, let's get over here to Andrew Simon. There are, as we know, we see them all the time, wellness campaigns directed at men and at women. More at who?
I mean, the reality is we see more female, more women, but they're both. The question is what is most visible and what is, we just came off of Breast Cancer Awareness Month. Obviously a very big to-do. It's changed dramatically over 10 years. I worked in the space, and I always look at it and I say, wow, 5 years ago, we wouldn't have pink everything. Now you can't turn, and it's the NFL, and it's
Major League
everywhere.
Baseball.
It's everywhere.
Canadian Football League.
Yeah, so some people say like, oh, now there's a pink backlash, if you will, and that's always going to happen. Something raises something, what's being ignored. So for instance, there's communities such as metastatic cancer, which is stage 4 cancer, very different cancer, and that community is underserved. So now one community feels very served and another feels underserved in relation. So it's quite interesting.
Dean, let's go back to this notion of who seeks care and under what circumstances. You're a urologist.
Yeah.
So when do men come to see you?
So generally speaking, we have sort of a bimodal distribution. We're going to see young men coming in just at the end of adolescence, maybe with some things that have carried over from when they're in their teens. Testicular cancer is predominantly between 18 to 35. But generally speaking, we see men coming into the office as they get to about 50 and plus. And often it's because they start to have urinary symptoms, the prostate becomes enlarged, and this may be their first point of contact with the healthcare system for many years. So when they're in their 30s and 40s, they're busy, they're working, they may go to the doctor every now and then, but they're really waiting until there's something that really pushes them, forces them into the doctor's office, and it's often the urologist who they see.
Well, that's what I was going to ask. By the time they see you, what percentage of your patients see you when it's quote-unquote too late?
Well, hopefully not as many as we used to see. We're doing better in terms of diagnosing, say, prostate cancer earlier with PSA blood testing, and the awareness has certainly increased. But a lot of men do come in with fairly severe symptoms, and they've ignored it, and they've put it off, and it's really that final straw that's brought them in, or their wives have finally said, come on, I'm taking you to the doctor's office.
You got a bit of upper lip stuff happening. Is that a Movember thing?
This is day 3 of Movember. Yes. Thank you for noticing.
Excellent.
Thank you. Yes.
How about, you look like you're doing the Movember thing all over.
I do a whole, yes, I am. I am. I wish what's lacking up here, I put over here.
Very nice.
Yes.
Do campaigns such as Movember, in your judgment, work?
100%. They work. And
they work to do what?
Well, this is the question. And it's always the question of any campaign in marketing. What are we trying to do? What are we trying to get to? So many campaigns do awareness. And awareness is wonderful, but awareness is not action. So the question is, and action doesn't mean just I'm growing a wonderful mustache. Action means, am I donating money? Am I going to the doctor? Am I checking an online tool to find out if I might be more susceptible to a particular disease, et cetera? So certainly in marketing, advertising, communications, we're always looking at what do we actually want people to do to change their life, change their behavior. Because it's great to know something, but it's very different. It's like knocking on the door versus going into the door.
Now, Movember clearly raises awareness. We've got people who, go for the mustache thing during that month. Is it supposed to do more than that?
It is, and it does. It raises a lot of money and beyond the awareness. And the website for Movember is wonderful, and they've learned over time, and things progress. I mean, people always point to the Ice Bucket Challenge, and they say, "Wow, that was fantastic." Some people don't know it's for ALS. It got people to take action, and that's always the case. The question is, what are we doing to whether raise money or making people aware of things? We do at Edelman, we do a trust barometer. We've done it for 17 years internationally, and it's been really fascinating to see that trust has dropped among government, media, institutions. It's increased among people that we know, people like us. And so that's where we look to our social media people and we say, like, what are they doing and why should I care?
So you say these campaigns are working. My follow-up for you is, are men therefore healthier as a result of these campaigns?
Absolutely. So I'm going to agree with you and say the campaigns are working. And men are becoming more healthy. What they're doing is they're seeking advice. They're seeking care from their physicians. But what we're also seeing is there's still that bravado out there. There are still those men that don't take advantage. October, Breast Cancer Month. There is a significant amount of men, from a percentage perspective, that have breast cancer. And these particular October-based marketing campaigns, sometimes, are focused towards women. And they forget about the male demographic. So my hope going forward and in the future at the legislative level and at the political level is that the marketing be more broad and reach those particular individuals in the male specter that aren't necessarily waiting for that prostatic pain or waiting for that issue when it comes to urology, but instead seek awareness before there's a problem. They go to the doctor, they get a normal checkup, and that's when you know that the marketing is working, it's effective, and it's making change.
Let's do a campaign here, and you guys tell me whether you think this works. We're going to show these two photos back to back, Sheldon. Let's bring these up, shall we? This is, this is meant to show how easy it is to get a prostate exam. And this is a parking meter. And, we all know how this works. You put your money in or you put your credit card in, and then you've sort of got to put your fingers up through the slot. Go ahead, show the next picture. Yes, you put your fingers up through the slot to take the parking ticket out. And that's, in essence, what you do to get your prostate checked. Okay, Dean, you like it or you don't like it or what?
I love this. When I saw this for the first time, I was on Queen Street and I thought, this is fantastic. I mean, this is everyday people making it not a big deal, sort of demystifying the whole concept of coming in to get a prostate exam. I think a lot of older guys have this sort of fear of what's going to happen when they go into the doctor's office because of the prostate exam, and I think this sort of dispels that. I think the other success of a campaign like Movember has really been to address the generational change. So a lot of Movember has been targeted to guys who are in their sort of 20s, 30s, 40s, like it has a bit of a younger feel. And I think that there's going to be a generational shift. It's cool to be a young man to take care of your health. It is important as a young man to go to see your doctor. And so I think, you look at hipsters, you look at people in their 20s, 30s, 40s who are working, you want them to get that message that they should go to the doctor. I think Movember's been really successful when it comes to that.
Andrew, this parking meter one?
I love it, but there's always a but. So When I look at this and I say it's surprising, which is what we want to do, we want to provide, and you don't have to be in a doctor's office to see a really important message and to understand what that is. So it's always wonderful. Context is everything. One thing I would take issue with, though, is okay, you understand what's going to happen. It's still happening to you. So, I'm not the one putting my fingers somewhere. So I would look at that and say, from a behavior standpoint, it doesn't make me feel any more comfortable with what's going to happen. And we know how sensitive men are. The man cold is devastating. I mean, you're out for weeks, months, years. So we have to understand the way that men's minds work. And we might be surprised and interested by this. The question is, are we going to do anything about it?
The fact that you could not just now say specifically what you actually wanted to say, but you had to couch it in alternative language, speaks to the fact that men are still uncomfortable about talking about their plumbing and all of this kind of stuff.
100%. Men are very uncomfortable about a lot of things. And psychologically, we're the strong ones. So we want to, nothing can hurt us. We're tougher than everyone else. And that's why we don't often go to see a very important physician. And yes.
I want Dion to follow up on that, because is there something about masculinity that simply does not allow men to either seek care or even comfortably discuss things that need to be discussed if they're to stay healthy?
Absolutely. And I think it has to do with how men are reared and how they're raised. I think it's that machismo essence. It's that reluctance to say, I feel pain, I want to cry, I need help. In reference to that picture, I saw it many different ways, and I agree with both of my colleagues. But the one thing that stood out for me was it wasn't overtly offensive. When we look at marketing, we have to examine religion, cultural background, awareness, and how people are reared in the society. That particular advertisement, agreeing with you as well, Dean, was perfectly done. There was nothing overly open. There was nothing that was too nude. It was open to interpretation.
It was clever. I mean,
it was clever.
It's clever, but to your point, it doesn't exactly reflect what actually goes on.
And I totally agree with you, Dion. But here's an issue. So we have these organizations which have many stakeholders. Everyone has a voice, and somebody might say, you know what, I see why that's an effective campaign, but it's a little offensive to me. And I'm worried that it's going to offend certain people. So then it gets put aside.
Exactly.
And so what we end up with things that are not as effective as they could be.
Pablum.
Because yes, pablum, the edges have been sawed off, and so now everybody's happy, but it's not getting anyone to do anything.
But in terms of that ad,
that one is
not
great.
offensive.
Yeah, and this is what I'll point to, is that is a single placement somewhere. That's not a giant campaign. That's not a Sick Kids campaign where we see everywhere.
Right.
And so those are the campaigns when I look at, I tip my hat every time and say, I can only imagine what you had to go through to get something like that sold in.
Exactly.
Do you ever have patients who simply drop out of the healthcare system because they just cannot abide the idea of having a prostate test or some other invasive kind of thing?
Well, I think that those are the type of people who aren't even going to engage in the first place. And it's unfortunately those men in this situation who are going to present to an emergency department much later on when their disease has really advanced. So we're not even able to engage them, to get them in the office to do the prostate exam. So I think the messaging is, guys, go ahead, get checked. It's not going to be terrible. And no matter what age you are, you have to remain engaged in your own health because it's important to you, but also your family, your community, the economy. There's many reasons why men's health is important beyond just the individual.
Do you have patients, Dean, who actually show up and when you indicate to them that you need to test their prostate by, in fact, inserting a finger into their rectum to check the size of the prostate, they then say, the hell you are, I'm out of here?
It rarely happens now. And I think that most guys understand that when they come into the urologist's office, they're going to get a digital rectal examination, a finger to examine the prostate through the rectum. But there's occasionally some guys who will offer a joke, buy me dinner first, something to kind of cut the edge,
because
right?
They're feeling awkward
because they're
about it.
feeling awkward, and it threatens their masculinity, perhaps, or some other notion that they may carry.
Well, you're a specialist, so by the time they're coming to you, they're hip to what's up. But if you go to the GP for an annual checkup and suddenly the GP wants to do this for the first time, And you haven't had it done before? You heard any stories about that where?
Yeah, I mean, I think there may be resistance. And also the GP has to deal with so many issues, right? They're worried about their blood pressure and their weight, diabetes. And so lower down on the list is that prostate exam. But GPs are clued in. They know they have to do it. And I think guys are increasingly willing to have the test done.
Okay, Andrew, let's bring another one up here. This is the so-called urinal puck. We're going to show everybody what this looks like. And there's a little notation on this. Dion, you would not have seen these before, but this is in a men's urinal.
I've seen them.
Oh, you have, eh? Okay. Yeah, they put these little, you know, whatever, fresheners.
I've seen the ad.
Put these fresheners in there, and there's a little thing on there. It says plus 50 with a check mark, prostate. So in other words, if you're over 50 years old, get your prostate checked. What do you think of that ad?
I love the placement because it is a place that men are, and men are looking at things. I would personally question the message in a way because I said, why is that message right there? I wish it took a little bit further. Not from a shock value, but why am I looking at this thing versus, you know, and let's be honest, I'm urinating on the message. So you have to think about also just what impact is it going to have? There could be an ad right in front of you at the urinal that would have the same effect. So why is it actually in the urinal other than I'm very surprised to see words where I'm peeing?
Was the message completely clear to you by seeing the 50 plus and the check mark and prostate?
No.
Not clear enough?
Not clear enough for me.
Huh. How about you?
Absolutely, I agree with you completely, Andrew. A famous communicator once said, the message is the medium, and the medium needs to be effective, and that is not effective. You are actually urinating on the message, but more than anything, where is the messaging that I take away? Where is the effect of it? How do you know I'm even paying attention to it? I don't think the placement is good. I don't think that there is any educated message that follows on with it, and I don't think many people are paying attention to it.
What did you think of it?
It was okay. I think it's hard to get the message pieced together. 50, prostate, check. I think if it was even more obvious, are you 50? Get your prostate checked. I mean, that would have been more of a direct message.
Leave less of it to chance.
Yeah.
Got it. Okay, Dion, let's talk about, there are other campaigns out there. Prostate cancer tends to be one of the bigger ones right now.
Right.
You know, Wear Plaid for Dad, this kind of thing.
Absolutely.
Are there other cancers related more particularly to men that we should be focusing on as well?
Absolutely. So when we're looking at a series of sarcomas, rhabdomyosarcoma, a cancer that starts in the muscle and tissue, huge with men. When it comes to prostate cancer, breast cancer is on a rise, and more men need to focus on identifying where those lumps are. We also need to focus on the lymphatic cancers, the Hodgkin's lymphoma, non-Hodgkin's lymphoma, checking our glands under our neck as men, checking under the armpits, making sure that you're also checking your groin area.
Dion, men don't do this.
They don't, but they should. And this is what the education is about. And this is why I'm loving that you've selected us here from a panel perspective, because you've got the doctor and the chief marketing officer who can tell you that responsibility can not only be in the hands of the GP. You have to take a certain level of responsibility for your own health. And with that, you have to either A, receive the messaging, get a level of education, or take ownership. So we have to educate from a young age on what we need to do.
How tough a sell is that with men?
It can be a tough sell, but I think getting that message across early is really important. So this whole idea of screening for, say, testicle cancer, testicular cancer, affects young teenage boys predominantly, right? And if you can get that message across that they should actually check themselves when they're 16, 17, 18, and it astonishes me that young guys will come into the office with like a big tumor on their testicle, and I think it was just embarrassment.
Well, shall we take a look at one of the ads that tries to encourage all of this? Here we go. This one's called Deadpool. Sheldon, you want to roll this? If you would, please.
Gentlemen, how well do you know your happy sack? I'm sure you rummage around downstairs more than Mommy would like, but it's time you started paying attention to your favorite pastime, because that bag of beans bouncing around in your hand could be trying to kill you. What? Yeah, because testicular cancer is the most common form of cancer in men aged between 15 and 35. It's time to fight back. Hold each of your manberries, or as I like to call them, smooth criminals, in turn between your thumb and fingers. Give them a gentle roll around. Don't get too excited, though. You're on a mission here. You also need to check the tubes around the back. That's the spermatic cord and epididymis, but I'm sure you knew that. If at any point you feel an unusual lump, size shift, or irregularity, don't ignore it like a pussy. Man up and talk to your doctor. The alternative is not an option.
Okay, the use of humor to deal with awkward issues. You like, you don't like what?
I like, I love.
You like, you love.
I love, because, and sometimes we forget in marketing, communications, people are people. So it doesn't matter if it's health, it doesn't matter if I'm selling shampoo, toothpaste, whatever it might be, what motivates us to do anything. So the Deadpool piece, I think, is revolutionary, truthfully. It's part of a movie promotion, so it actually is a win-win for everybody. But the fact that here it is, and here's Ryan Reynolds in character speaking to you, expressing as he would talk in character, and actually teaching you something, and guess who that targets? Who's going to see Deadpool? 15 to 35 young men. It's perfect. It's absolutely amazing.
Do you actually, as a young person, watch this ad and come away thinking, checking out my testicles is cool?
I think so. And interestingly, even though we focus on the male, and of course we know a lot of young men would be going to see the movie, he also did a piece for breast cancer and breast cancer awareness. So we tend to, I mean, Ryan Reynolds is a good Canadian, so
yes,
good for him. But it was also very easy. He's in character. He doesn't have to be on camera. So it's just his voice and then whoever's playing him behind the mask, and a really effective means of getting the message across.
Does it have to be, in order to grab this younger generation, does it have to be cool to resonate?
Not always, but it certainly is effective. And I always say, like, how do you talk in somebody's language? If you're inside their head, you understand what motivates them. So, for instance, we did a campaign. There was a fellow who goes by the name of, or he's been coined, Dart Guy. So a fellow who was watching, it was at a Maple Leafs playoff game. They showed him on camera for 6 seconds. And he blew up in social media because he had a cigarette hanging from his mouth. And
well,
so
he also had his face painted with a maple leaf.
Yeah, but this,
and he was a big guy.
He was a big guy, but he was on for 6 seconds. And so it blew up. Everybody called him Dart Guy because Dart equals cigarette. So we actually contacted Jason, is his real name. He actually has a real name. He doesn't go by Dart Guy. And said, out of curiosity, are you a smoker? And he said, yes, I smoke a pack a day. And I said, would you be interested in quitting smoking because we represent Nicorette? And he said, I actually would love to quit. So what became a little phenomenon we took advantage of for a client, and it was, again, a win-win. So he went on air, we posted, we sent him all the materials, et cetera, and he talked about his journey. And everybody picked it up from, from all those who were talking to him from TSN, et cetera, and all the different radio stations. And they said, this is great, like, come along with his journey. So here is somebody who is doing something very good, and it's very difficult to reach that audience otherwise. And it wasn't like we were planning this for a year. It just popped up and we took advantage of it.
It had to be clever and cool, though, to work.
It had to be clever and cool, and people had to look at him and say, this is somebody like me, my, face painted, et cetera. And he is a celebrity. If you go to a game and people are surrounding him, taking pics, and it's great.
Did he actually quit smoking?
He is on a journey. It is very difficult. Yes,
yeah.
yes. So he was much like other people when they announce that they're quitting and then they fall back. They have a little hiccup. So he is committed to doing it. But it was wonderful, and we knew that going in that he might not follow through. And we said, there's no question. The journey is tough. So this is actually very representative of real life, and we're going to continue to help him.
Gotcha. Let's do another one here. This one's called Father and Son. The Brits are pretty good at humor, I'm told. So let's see one of their ads for getting your prostate checked. Sheldon, Father and Son, if you please.
Been ages since we've had a father-son chat. You're getting older, and your body's going through a lot of changes.
Yeah.
Do you know what your prostate is? Your prostate is the thing that produces your stuff. If your prostate gets cancer, it might need to come out, which could make adult nap time a little tricky. And that's not even the worst part. You could die. So, there's this website I found.
All right, fine. I've got it. Can I go now?
No,
Dave's
you
waiting.
can't. You and all your lot of friends need to do something about this. Now.
Oh, this is ridiculous. All right.
Okay, why does this one work?
It's turning the tables. So it's a recognizable situation. Everybody's had the talk, or I hope they have had the talk. And so to flip it on its head, and that would surprise people and say, oh, here is a son who's talking to his dad about something that's important. And you know, when you think about it, it's like, okay, even this guy gets it. And humor, again, is a wonderful thing. It works for Old Spice, beer, whatever you might, deodorants, etc. And we always say it's like, how do you get people on your side? And that's a wonderful way to get people on your side.
Can you use the same approach in trying to do awareness campaigns for men as you would with women?
I think you always have to think about your target, and the answer is yes and no, because for men, sometimes, I mean, we know the effect of humor. Humor works for women as well. Humor works for children. It's just, how do you surprise people and to, again, make them think about the issue differently? But we'll make the point about awareness. Again, it's great that you know. How do you do something about it? So the best communications are the ones who are going, and back to the Deadpool thing, there was instructions on screen about exactly how to examine yourself. That is super effective. It's not just saying like, you should know about this, and by the way, testicular cancer is up. That would be, in my mind, ineffective. This is exactly how you can examine yourself and then go to a doctor.
You know what, Dion, let me follow up with you on that, because because of the awkwardness that men have, there is a certain kind of cleverness or humor that you can bring to bear to get men to pay attention to something they might not otherwise do.
Absolutely.
I wonder if that would work with taking that approach, you know, going for clever and funny in a breast cancer campaign. I don't know if that would work. What do you think?
And speaking from a female point of view, no. Receiving a breast examination is a difficult process, particularly if you've got a history of breast cancer, as it would be for men if there was a history of testicular cancer. Humor does supersede many things: culture, religion, bias, etc. But when it comes to information and how it's being received, you have to be very careful of who your audience is. There are very intelligent people who work on marketing campaigns, and they analyze algorithms, and they analyze community affairs, issues, demographics. And in doing so, women have a sensitivity gene far different from a man's. Women have an emotional gene far different from a man. So when it comes to the sensitivity of issues specific to cancers and/or diseases, we have to approach them sometimes with kid gloves. Whereas when it comes to campaigning, development, as well as extension, it's really about analyzing the audience. So I agree with you completely when you say you've got to look at who's developing it, who the audience is, and the why. But I absolutely will stand strong in my statement and state that women will not respond to humorous campaigns about breast cancer the same way.
Andrew, I wonder about that too, because mammograms are not pleasant.
No.
It's just not a...
They're painful.
Right. They're painful, yeah, in a way that sort of the 5-second long prostate exam, just can't compare. So humor and clever may not work for a breast cancer
Well, I
campaign.
think back to the audience. What is the audience? So the breast cancer community wouldn't stand for that. Truthfully, and everyone, no matter what the disease is, people have died. So that's serious business. But testicular cancer, okay, you'd say, well, why does humor work over there? Because people have died from testicular cancer as well. It's understanding back to the who you're talking to and why you're talking to them. And I would say I've done a lot of breast cancer campaigns that are very serious and very dramatic, and people have thanked me and sent me notes, whether it's in social media, et cetera, and they said, thank you for understanding. And that's what it's all about. It's like really understanding the psyche and how serious some diseases can be.
But it's also the barriers, right? So one of the barriers for getting men into the office is the sense of masculinity. And that's the target that we're trying to sort of overcome or break down. And so that's where humor plays a really important role. So you have to look at what is going to actually target what is preventing them from getting in the office in the first place. And I think humor is a great option for men.
Well, and I'll bring up one other, because I was just thinking about this from breast cancer. There was an ad a few years ago where it was actually a very good-looking person who was basically taking you through a breast exam because women couldn't show that. That was a very clever use, and I think it was very effective at the time and very disarming. People didn't expect to see it, but a lot of women watched it because they said, here's this good-looking guy, and I want to see what he has to say to me. So it's a very interesting, and it definitely towed the line. And you could say, is that really actually offensive? Because this is a very serious...
You've touched on something, because it's the aesthetic element of it as well. When we think of cancers and sometimes the outcomes for women aesthetically change us.
Yes.
And they change us in a way where sometimes you're approached by people and they say, well, why have you lost your hair? And then you have to explain the disease. And sometimes with men, losing their hair could be what's in this season, right? Or when it comes to having a rebuild, it could be something that's obviously seen. Whereas if we're looking at a testicular implant, that's something that's hidden and only shared with perhaps somebody you're having an intimate relationship with. So it really is about the private and the public element of the campaigning as well, and how the message is received.
That's interesting. Dean, I should follow up with you on that. Obviously, many women choose to have reconstructive surgery if they lose a breast to breast cancer.
Right.
Do men have reconstructive surgery if they lose a testicle to testicular cancer?
Well, they do, and you can get a testicular implant, and it's an option that's available to every man who comes in and has one or both testicles removed for cancer. But I would take it a little bit step further with the reconstruction in cancer if we're looking at sort of analogous diseases. So breast cancer, you have breast reconstruction, and it's a very visible manifestation of the disease.
Exactly.
Whereas men who have prostate cancer treatment, the side effects are often the loss of the ability to have an erection, right? They lose their potency, which is really their sense of manhood in many situations, and it's not visible to the outside world. So a lot of these men are suffering both with urinary incontinence, leakage, and the loss of sexual function. And so we do have reconstructive surgeries that are really not actually aesthetic, but functional. We can actually put implants in to have men functional again. But until that happens, they're really suffering in silence.
Yeah, that private function or that private suffering that takes place. Agreed.
It's a guy thing.
Absolutely it is.
Friends, thanks a lot for coming in and helping us out with this tonight. Much appreciate your contributions to this subject. There on the left side of the table, Dean Elterman, urologist, Toronto Western Hospital, and Dion Duncan, Halton Region Care Services Network. She works in health policy and informatics. And there's Andrew Simon, the Chief Creative Officer at Edelman, the public relations firm. Good of all of you to come into TVO tonight, and good luck with this.
Thank you very much.
Thank you.
Thank you.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.